Hi there, so my name is Karan Sampat. I'm a consultant obstetrician based here at Darent Valley Hospital, and the reason for the talk today is to inform you about interventions that might be required when you're in labour. So for those of you who are aiming for a vaginal delivery, or a spontaneous vaginal delivery as we call it, there's always a potential possibility of ending up with either an unplanned cesarean or an instrumental delivery. So when we say instrumental delivery, that could be a forceps or something called a ventouse may be used to assist delivery of your baby's head. So firstly, I'm going to talk about unplanned cesarean sections. So the chances of needing that is around 15% for any woman who's planning on having a vaginal delivery. The reasons for an unplanned cesarean would usually be either that your cervix is not opening once you're in labour, and your cervix needs to reach 10 centimetres for you to push a baby out, or if your baby's getting tired inside, so there's concerns over the heart racing of your baby. And what it would involve is you having usually pain relief into your back, a catheter in your bladder, and then a bikini line cut lower down on your abdomen. So very occasionally women do need to be put to sleep, so therefore have a general anaesthetic for a cesarean section. And then you'd be in theatre, so there'd be an anaesthetist and what we call an ODP, an operating department practitioner who's assisting the anaesthetist. You'd then have your surgeon. The surgeon would have an assistant, there'd be a scrub nurse, and there'd be a runner as well, so you can expect at least 6, if not people in theatre. Possibly even more in an emergency, or if your baby might have additional care requirements. And the other options, obviously, if you were to need help, would be having an instrumental delivery. So the chances of needing one of those is approximately 10%. And the reasons would be quite similar. So either, you'd have to be 10 centimetres to have an instrumental delivery. So you might be pushing and the baby's just not coming out. You're feeling exhausted. Or again, there's concerns over the heart rate of the baby while you're in labour. Now, usually someone would speak to you about it, but it can be quite rushed if it's an emergency scenario where there's concerns over the heart racing of your baby, hence the reason to try and talk about it now, to just try and prepare you for that possibility. And it would involve pain relief, which could be pain relief into your back, or it could be local anaesthetic administered down below. Your bladder would need to be emptied, and you'd need to have another examination just before the instrument is applied to the baby's head. Then after that, you would need to push as well as the baby, as well as the doctor pulling. So this is very much a sort of group effort, and the idea would be that over the next 3 contractions, your baby's head would be delivered, and then after that, your baby's body would be delivered, and then your placenta. And yes, and then after that, you may require some stitching down below, and then dissolvable stitches can be used to achieve that. So whoever has been the midwife who has been looking after you, and the idea is to try and provide one-to-one care until your baby is born. So that midwife would then accompany you into theatre and try and support you while you're having your pain relief into your back, and then would take the baby as such from, or would be after baby's born, and would then bring the baby around to the other side of the curtains to where you are, so that you can see and bond with your baby. So we have planned cesareans and unplanned cesareans. So there's 4 categories that are applied based on national guidelines. So a category 4 cesarean is very much a planned procedure. It's done at a time that suits both yourself and the healthcare providers that are looking after you. That's when you'd be given a date, and you'd come in on the morning on that day and have your procedure, usually in the morning, but sometimes it can be in the afternoon if labour ward is very busy. A category 3 cesarean would usually be if, say, you're going to have a planned cesarean, but then say you've broken your waters and you've come in before that date. You're not contracting usually, but we have 24 hours from when the decision is made to perform your cesarean section. It's kind of a semi-planned procedure as such. Then you have a category 2 cesarean, which should be done within 75 minutes of the decision being made. So those are the ones that are usually done in labour, and it's usually because your cervix isn't quite opening, it hasn't quite reached 10 centimetres. And then lastly, there's a category 1 cesarean, which is the most urgent, and that's usually done when there are immediate concerns over the safety and well-being of your child. Usually because there's concerns over the heart racing of the baby, and that means that the baby needs to be delivered quickly within 30 minutes of the decision. So most women would be going home after about 2 nights in hospital. Some women do go home after 1 night, and it's important that you meet certain milestones before you go home. So before discharge, it's important that you are passing wind, that you're able to empty your bladder, and that you're walking around independently. It's also important just that you have been able to resume eating and drinking without encountering any problems as well. So fragment injections are injections which thin your blood out to try and prevent you from getting blood clots, usually in the legs and on the lungs. We give fragment injections to all women after cesarean sections, and it's usually a minimum of 10 days post-operatively, and sometimes that does need to be extended to 6 weeks. Blood clots are the most common reason for a woman in the UK to become seriously unwell in relation to pregnancy or just after you've had your baby. So it's really important that you do take those injections. So once you've had a cesarean section, it's important to just listen to your body. So in terms of a common question that comes up is about driving. In my practice, I don't specify a time limit for which you shouldn't drive. Your insurance company, however, may specify a time limit. What I do say, and I follow Royal College advice, is that you need to be able to perform an emergency stop before you drive. So sit in the car with the engine turned off and just try and do an emergency stop. Press down really hard on the brake. And if that doesn't cause you pain, that's usually a good sign that you're okay to drive. And another thing as well is if you can actually look over your left shoulder, look over your right shoulder, and if you can do that without encountering pain, then again that should be a thumbs up in terms of getting back on the road.